Hello, my name is Michael Petit, and today we'll be talking about oppositional defiance disorder. Take a moment to read these three questions and come up with some answers. I hope this helped to get you thinking about the idiosyncrasies of behavior. So, what is behavior? Behavior is a social construct. There is no consensus on what is good or bad. A multitude of factors like cultural norms, home or school environments, and community climate can drastically affect the interpretation of any particular action. The way to identify behavior in a student that is exceptional is by looking at the chronicity, severity, and pervasiveness of the action, and then comparing it to how a typically developing child would behave. Oppositional defiance disorder, or ODD, is a social disability that affects students in their interpersonal interactions. Symptoms include frequent temper tantrums and anger, excessive arguing with adults, active defiance or refusal to adults, deliberate attempts to upset people, blaming others for their misbehavior, and being easily annoyed by others. Some reasons a student may develop this disorder include transactional and dissonant parent child relations, trauma and abuse, and neurobiologically altered mental functioning. The dysregulation of emotions in students with ODD affects their information processing so that it is increasingly difficult to do the following: maintain concentration, understand social cues, read neutral or positive facial expressions, express or feel love and or happiness, and respond in any way besides negative resistant and or aggressive behaviors. Girls are less likely than boys to be diagnosed with ODD, as is consistent with sociocultural differences in how the two genders are socialized. When girls do have ODD, they tend to have more internalizing behaviors associated with anxiety, depression, bodily distress, and social isolation in an attempt to suppress a masculine aggression. Oftentimes, ODD is comorbid with other disorders such as ADHD, OCD, auditory processing disorder, depression, anxiety, PTSD, etc. Additionally, students with ODD often share their disorders with their parents, with fathers of students typically having depression and mothers of students typically having profound aggression. ODD has future ramifications beyond the already destructive symptoms exhibited in its early stages that can be described as a cascade of impairments. ODD is a strong, positive correlate of delinquent behavior, particularly in late adolescence. Students with ODD engage in drug use at higher rates than students without behavior disorders. These students do worse in school and have IQs that slow folly into a lower range than is average for their age. They have difficulty making or maintaining friends or relating to adults. Before a child is treated for ODD, they must undergo a functional behavioral assessment as mandated by IDEA. Treatment for ODD is heavily involved with the parental unit. Some examples are the parent management training programs, family psychotherapy, and parent-child therapy. Individual-based treatments include individual psychotherapy, cognitive-based problem-solving training, and social skills training. Pharmaceuticals may be used if a student's ODD is comorbid with ADHD, but they are not considered as effective as therapy. Preventative measures for inhibiting the development of ODD focus on violence prevention, including recognizing histories of trauma, PTSD, and/or victim coping. As educators, we can have a hand in helping these students at any stage in their disorder. Teachers should identify and monitor students at risk of ODD and consequently promote desired behaviors while decreasing undesirable behaviors through contingency management. This includes showering the student with praise when they follow directions that are seemingly simple, like sitting in their chair or raising their hand. On the flip side, Positive reinforcement alone has been proven to be ineffective if not combined with consistent and progressive consequences. Teachers should be cautious about their tone of voice since students with ODD struggle with even neutral expressions. This is especially true when giving warnings. They need to be concise, specific, and have effective follow through. It is helpful to figure out what the student enjoys. If they enjoy music class, for instance, the music teacher can work with the school counselor to offer one-on-one lessons as a reward for improved behaviors. In conclusion, ODD is a severe reality in many students' lives, but does not need to stay that way. Instead of avoiding these challenging students, teachers can become a protective factor by being a positive and encouraging mentor. Teachers can avoid frustration by collaborating with their coworkers to establish consistent procedures, standard language, behavior charts, and best practices for the particular student. The old adage, "it takes a village to raise a child," is most true for students with ODD. It is our responsibility as educators to nurture their growth through equitable means to ensure a culture of safety and improvement in our schools.